And any, I said she's going to get questions from you guys, so go ahead. Thank you.
Well, thank you all for having me. This is a nice group, so and I've only heard good things about them.
Oh, God, it must be false.
Somebody's lying.
These two, what have you heard?
Right, paying off somebody well, but anyway.
True, lying.
Right,
Yeah.
right. Yes, and I know a couple of people who have been patients of ours, so it's wonderful. And Augie called me and asked if I would come and speak to everyone, and so I'm happy to be here. Thanks to Augie. And really, you know, we just hold on. Okay. Basically, he asked for me to focus on what a nurse practitioner is, because a lot of people don't know what we are and what we do and how we differ from, say, a regular nurse or a physician's assistant or even a physician for that matter. So it's a question that I receive a lot, and so I think it's a good topic to discuss. So I thought I'd start first off just looking at nursing in general and, you know, the different categories of nursing, because people are sometimes confused by that. So basically, especially a few years back, we had a lot of LPNs, which is a licensed practical nurse, and that's a one-year degree that a lot of people pursued at that time. Unfortunately, they're starting to kind of phase out LPNs now, or using them in different capacities, so you don't see many of them around anymore. The next level is an associate's degree RN, which is a 2-year associate's degree. You still have to pass your nursing boards, but you function in hospital or clinic settings. The next is the bachelor's degree RN, which is a 4-year degree, and that's the majority of nurses out there now. And then you can go on to pursue your master's degree, which is another 2 years, so 6 years total, and that's what's required to be a nurse practitioner. So you can go to different programs of nurse practitioner schools. You can be a neonatal nurse practitioner, or you can be an adult-focused nurse practitioner, or gerontology, which is a big booming career out there because we have a lot of baby boomers that are needing health care. Or you can do family, which kind of encompasses all of that, and that's what I chose to do in case I wanted to move and do pediatrics, or I wanted to focus on complete older adult health. So it provides a little more variety, I guess you'd say. And then you can also do an acute care where you would focus mostly on ICU type care. They're starting to push for all nurse practitioners that are going back to school now that they will actually have to get their doctoral degree. So that'll be another full year of schooling, which has a research focus. And I'll be honest, I'm glad I'm not having to do that. I'm fathered out of that, so we're good. Grandfathered out, I should say. So once you obtain your master's degree, then you also have to pass your board certification. So that's an exam that you have to pass with a certain percentage to get through. You also have to obtain your state nurse practitioner licensure. And then for those that want to prescribe medications, which most do, you have to pass a DEA exam and be able to prove your, I guess, your pharmacological knowledge as well as the rules, especially with medications such as narcotics and things like that. So once you have all of that, which is quite a process, then you can apply for positions. I would say the majority of nurse practitioners are employed in primary care because there is a big shortage there. So that's where a lot of people end up. But if you have a liking for a specialty, then you can pursue that as well. And I've always worked in cardiology, so that's where I wanted to end up, and that's where I am now. One other thing that people ask is, well, you know, how do you stay up to date with research and, you know, the latest and greatest cardiac procedures that are out there? And just like physicians, nurse practitioners are required to obtain educational credits yearly. You have to have 30 per year, and you have to recertify every 5 years. Any questions about that so far? Kind of the educational piece or the differences between?
I do. You said
Yes.
they're redirecting the LPNs to what positions?
Yes, and they're starting to use LPNs more in like a medical assistant arena. They're not letting them serve as RNs, I shouldn't say RNs, or as nurses in the hospital anymore. They've made that an associate or bachelor degree requirement. So in our clinic, some of you may know Gloria. She's a wonderful employee, and she is an LPN. So she is the one that takes our patients back and does the vitals and takes phone calls and all of that. So still a very useful position. Unfortunately, they're just kind of rerouting them out of the hospital setting.
Yeah, thank you.
The DDA you're talking about, what is that, drug?
Right, the Drug Enforcement Agency
Okay.
exam. Yep. So, to kind of date back a little bit, the first NP program actually was initiated in 1971. So NPs have been around for over 40 years. And in 2014, it's projected, actually 2014, there was more than 205,000 nurse practitioners, and that's projected to just keep growing and growing. And one of the main reasons is because there is a physician shortage, and there is going to continue to be. They project in 2025 there'll be a shortage of 130,000 physicians, and 52,000 of those will be in primary care. So they're really looking at nurse practitioners to kind of help fill that gap, especially in the primary care arena, but also in the specialties. And a lot of people will say, well, how come there's a physician shortage? Well, there's a lot of different answers to that, but some of the main ones are there's a lot of physicians that are also aging, a lot of baby boomer physicians that are getting ready to retire. And also with just the insurance changes, reimbursement changes, some physicians are steering away or not promoting that as a career for their children and things like that, unfortunately. So what does a nurse practitioner do? Basically, what it is a collaborative relationship with a physician in managing acute and chronic conditions. So it's looked as a partnership between your physician and yourself to care for all of the patients that you have. And that can be in the clinic setting, that can be in the hospital setting, and also another area is, just all the work that's entailed in phone calls and paperwork and things of that nature, and various testing that we do as well. So most nurse practitioners, like I said, will either work in a clinic or some will work in a hospital. Some will work in both, which is what I do. Just like a physician, we're able to take a full history from a patient, do a full comprehensive exam. We order and perform and interpret all diagnostic testing and lab results and make recommendations based on those results. Prescribe medications, as we said. And one of the biggest pieces, and I think one of the most important and rewarding pieces, is the education aspect. As some of our patients know, the physicians are very busy. They have a lot of procedures to do, at least the physicians that I encounter. And sometimes those procedures are acute. They need to happen immediately if somebody's coming in with a heart attack or whatnot. So we have to devote some of our cardiologist time to those procedures. And that's where we're able to kind of pick up that gap and step in for them. So being able to see patients in clinic and actually take a half an hour instead of 10 minutes and really go through your cardiac status. What type of procedure did you have? What are the expected medications now, and why are they needed? What type of lifestyle changes do we need to have you implement moving forward to keep you from coming back for another procedure? And there's a lot of reinforcement that's needed with that. And sometimes the physicians just don't have that time to sit down and do that. They would like to, I think, but unfortunately their procedure schedules keep them from doing so. And so the nurse practitioner is looked at as, treating the patient as a whole, looking at the patient as well as their disease state and how it affects their family, social life, things like that. And research has shown that nurse practitioners do have a very positive effect on the outcomes of chronic disease states such as hypertension, diabetes, hyperlipidemia. Patients' outcomes, they've actually shown to be improved. They've had greater satisfaction, and most NPs survey exams say that it's a more rewarding career than most physicians will say it is to them. So another question is, how does a nurse practitioner differ from a physician's assistant? Yeah, it's a very common question. And really, in today's world, I would say the majority of us function the same. It's basically how you go to school, to be one or the other. So a nurse practitioner is obviously a nurse first. You've worked as a nurse either for 4+ years, at least, and then you go back to pursue your master's degree. So I think that is quite the advantage because you've worked with patients, you've had the experience, you have a foundation of healthcare knowledge, you have skill sets such as IVs or catheters or NG tubes, whatever it might be. And then you go back to further, obtain knowledge, and you have a specific clinical set that you have to complete where you go through, ICU rounds. You go through specialties like cardiology or nephrology, and so you pick up more detailed knowledge that you add onto the foundation that you have. So an NP obviously goes back for their Masters of Nursing, whereas a physician's assistant, they attend a center of medicine right from the get-go. It is also a master's degree, so both are 6 years. But it's looked at that the NP kind of follows a more patient-focused model, whereas the PA follows a more diseased-focused model. Not that, of course, each one doesn't care about the other, and we don't have crossover, but that's kind of the gist of the education behind each, where the focus is. So NPs work more as a teammate of the physician. They see patients independently, but with the oversight of a physician, whereas physician's assistants kind of work directly underneath the physician, and a physician does have to sign off on everything that they do. And across the country, there's actually about 250 practices that are solely run by nurse practitioners independently, no physician involvement, whereas a physician assistant cannot work independently without a physician. So that's another bonus for us nurse practitioners. Any questions about that?
Just
Yes.
me.
Yep, that's good.
Are the insurance companies now loosening up on the acceptance of diagnostic stuff and everything from the nurse practitioners? I know I've had problems in the past where, no, it's got to be the doctor, it can't be the nurse practitioner.
I wonder why. Really, say Dr. Khatib and myself, I can order any test that he would order,
Okay.
and it should go through.
Okay.
We have a lot of insurance punch down on testing as a whole, unfortunately, whether he orders it or I do. We have to do a lot more breaking through the red tape, if you will, and peer-to-peer reviews and providing rationale. But certainly it shouldn't matter whether an NP would order it or a physician. It may have years back, but it shouldn't.
Yeah, this was
really matter.
probably 5 years ago.
Yeah, that's a good question.
We had problems with our insurance company, with my wife, seeing a nurse practitioner, and they said, no, you got to see the doctor.
You have
Okay.
to see, you have to sign off.
Yeah, you have to sign off on everything.
Yes, and not to get too detailed, but there's 2 ways that a nurse practitioner can see a patient, say in the clinic setting. You can see the patient where you do the whole visit, but the physician does come in at the end and kind of provides the overall summarization and agrees with the treatment plan. And that's called an incident 2 visit. And that is billed then under the physician's name because he actually was involved. The other way to do it is where the nurse practitioner solely sees the patient independently, and it's billed under the nurse practitioner's NPI number. Now really, different insurance companies may want to cover just one or the other of those. I know Pro Healthcare, we used to do an incident 2 where Dr. Khatib and I would share the visits, but now they have changed to completely independent nurse practitioner billing. So Dr. Khatib does not have to step in on any patient that I see now. So there's been a movement to change that, and so
Yeah.
maybe that's why it
And
is.
so the insurance company's probably smartened up and such.
That's right. Yeah. Well, I think that's true. I mean, it has taken a few years for insurance companies to see that nurse practitioners provide at least equal care. In some, again, patient satisfaction surveys, they say higher. And that the patient outcomes have been improved with nurse practitioners now being on board. So I think they are now starting to see us, you know, as an integral part of the whole healthcare team, and will now start to pay for it regularly. And it just takes time to prove that with anything.
Sure, thank you.
So really, just a little bit about myself. I started out as a business major. I thought I was going to be an accountant to CPA. That's what I went to school for. But then, unfortunately, I had a friend who was diagnosed with breast cancer, and she died, unfortunately, at the age of 23. And I was with her every day in the hospital. Yes, and I was just amazed at the care that the nurses in particular provided to her. And it really changed my whole view on healthcare and just what I wanted to do with my life. So I changed my major. I went to El Vernal College and became a nurse. And then I worked at St. Luke's Medical Center for quite a few years there on a heart care unit. And I loved that, and that's what kind of got me into the cardiology arena. And then I went to work in the cath lab, which a few of you know about, I'm sure. Unfortunately. But that was a nice transition because you actually get to see, you know, the procedural side of things. And, you know, you learn a lot about the hemodynamics and the technical side and the, you know, what the physician has to do and how skilled they have to do to be able to complete those procedures. So that was a nice few years experience for me. And then there was a cardiologist there at St. Luke's that I got to know, and he asked me to come and work for him. And that's what I did for several years, about 9 years, as a nurse, an RN. And a lot of nurses did that for quite a while. They didn't have authority to write prescriptions or do complete independent care by no means, but did a lot of the things that I am able to do now. But insurance put the crackdown on that, and they said no more RNs in that setting, you have to be a nurse practitioner. So since I really enjoyed that role, I decided to go back. I went to UWM and got my master's degree there. At that time, I was working full-time. I had 2 small children, so it was a bit of a struggle. I wanted to pull my hair out, and it took me a little longer, about 3.5 years versus the 2 if you just went straight through. But it was the best thing I ever did. After I was done, we actually moved out to Mugwanago, and I didn't want to commute to Milwaukee any longer, so somebody told me Dr. Khatib was hiring, so I applied, and here I am. And that was about 5 years ago, so it's been a joy working with him. I'm not sure if you all know him. He's a wonderful man, very down-to-earth, genuine fella, and he is great to work for. And really, for me, it's the blend of the best things you could have, because I'm able to do all of the, what I feel, the positive things about being in healthcare, and that is seeing patients, treating them, educating them, helping them understand their cardiac situation. But yet, I don't have any of the negatives, such as evening hours, on call, holidays, or weekends. So, and that's what comes along with being a physician. So it's a nice balance that I have a very rewarding career, but yet I can have a nice family life and a good balance with all of that. So, so sometimes people ask me, well, you know, what do you do every day? And basically, I will see any of the patients that Dr. Khatib has at the hospital, whether it be Waukesha Memorial or Oconomowoc Memorial. So I will see them and examine them and either order or review any testing that's been done, talk with them about what brought them in, what we need to do, you know, going home, different medications, treatment recommendations, follow-up, all of that. The other thing is seeing patients in clinic. So we will usually see patients every day in at least one clinic site. We have 3 sites that we go to. So usually we'll go to 2 out of the 3 of those every day. And I will see patients in clinic. Dr. Khatib will see patients there in clinic. I will monitor the stress testing at most of our clinic sites while he is, again, seeing patients. It allows him to have more volume on the clinic side. I can do his stress testing for him. And then, like I said, we'll go to at least a clinic in the morning, hospital in the afternoon, or vice versa, just depending on the day. And then, of course, there's the office component. And that's a very important piece of the puzzle, too, because as many of you probably have, you've called the office with questions, concerns, symptoms that you're worried about, and we need somebody there to triage those calls. We, again, have Gloria, our LPN, who's kind of our front-hand woman there to take those, but then she'll kind of look into it and pass those on to me. And usually I'm able to answer those questions, but of course if I'm not, then I'll go to Dr. Khatib for further advisement, and we're able to get back to the patients. So basically, there's your cardiologist, and he is occupied with clinic time, testing time, procedural time. Then there's the nurse practitioner that kind of helps to fill in those voids, helps to see the overflow of patients, because he couldn't possibly see all of the clinic patients that want to be seen on any given date or time. And it allows for more testing, it allows for more procedures, it allows for more clinic sites, and that way we can serve a greater, patient population. And, for me especially, like with Augie or Bob, it's nice for me to get to know everyone. It's nice to, well, not nice to see them in the hospital, but I see them in the hospital. But then to be able to also follow them to the clinic and hopefully keep them out of the hospital. But really get to know them, make sure that they understand what's happened to them, how it's going to affect them, and how we can improve upon things. And getting to know them and their families. And just the fact that I have many patients that solely come back and keep following with me. Not that they don't like Dr. Khatib, but I think they enjoy the time that I'm able to provide them and educate them. And it's just so rewarding that I'm able to do that and affect one's cardiac life. So, because we all know the heart is the most important muscle of the body. So at least that's what I like to think. And unfortunately, heart disease is the #1 disease state in the country. Unfortunately, kills more people than all cancers combined together. So it's something that needs a lot of attention. It needs a lot of preventative care, which is a big part that I play. And unfortunately, it's pretty good job security because of that. So that's really about me and kind of what I do and how I help Dr. Khatib, but I'm certainly open to, again, more questions that you might have.